All right, let's jump into a deep dive today all about canine urinary diseases.
Oh, interesting.
We're going to be taking all of our information today from this source
Okay.
called Urinary Canine Planner, Welcome to Vet Candy.
All right.
Now, this is really interesting because this is actually a study guide that's meant to prepare aspiring vets for their licensing exam.
Oh, cool.
So we are getting the information straight from the source,
Yeah.
no fluff, no filler.
Right to the good stuff.
This is how you become a vet. This is the information.
Yeah.
So think of it like a crash course in all things bladder and kidneys when it comes to our furry friends.
Okay, great.
We're going to be exploring these diseases in the same order that they're laid out in the study guide, which I think will help us to understand,
Yeah.
kind of the way that a vet student might learn this information.
Yeah. Yeah. No, that's great.
And who knows, maybe you'll even pick up some trivia to impress your fellow dog owners at the park.
Oh, absolutely. Always good to have a little bit of extra knowledge.
So,
Yeah. This is a great way to get a glimpse into what vet students are learning and how they prepare for real world cases,
totally.
that they might see.
Okay, let's dive right in.
Okay.
So the study guide talks about the big five in veterinary medicine.
Okay.
You got dogs, cats, horses, cows, and pigs.
All right.
But for today, we are focusing only on our canine companions,
Okay.
just the doggos.
Gotcha.
And this information in the guide is actually pulled from some of the most respected veterinary resources out there, like the Merck Veterinary Manual.
Oh, wow.
So we know we're dealing with top-notch information.
Yeah, that's a big one.
Yeah, the real deal.
Mm.
So first up is Fanconi syndrome.
Okay.
Now, I'll be honest, I don't know anything about Fanconi syndrome.
It sounds a little intimidating, right?
That sounds pretty
Yeah,
intimidating.
yeah.
Especially because I feel like maybe it's not that common.
It's actually a rare genetic disorder,
Yeah.
but it's important to understand because it can actually mimic diabetes, which can really throw off even experienced vets.
Oh, so you might think it's one thing, but it's actually something else.
Yeah, exactly. Basically what happens is it affects the kidney's ability to reabsorb essential substances back into the bloodstream.
So like things that should stay in the body are actually getting flushed out
Exactly. Yeah.
through the urine.
Yeah, they end up in the urine when they shouldn't be.
Okay, interesting.
Yeah, and where the key signs of this is something called glucosuria without hyperglycemia.
Okay, break that down for me.
Yeah, so glucosuria basically means there's glucose in the urine,
Okay,
just like in diabetes.
right.
But the difference here is the dog's blood sugar levels are actually normal.
So they're not hyperglycemic.
Right, exactly.
Oh,
So that's why genetic testing is so important for diagnosing Fanconi syndrome accurately.
okay, so you can't just look at the symptoms. You have to actually do a test to confirm.
Yeah.
Okay, very interesting.
And, speaking of genetic predispositions, certain breeds like Basenjis are particularly prone to Fanconi syndrome.
Okay, interesting.
Yeah.
So if you have a Basenji,
Something to be aware of.
be on the lookout.
Yeah.
What about amyloidosis?
Amyloidosis.
That one also sounds a little scary.
That one's a bit more complex.
Yeah, break it down.
So it happens when abnormal proteins, called amyloids, build up in the organs and start disrupting their function.
Okay.
And the kidneys and liver, they're often hit the hardest with this.
So it's like these proteins are just gumming up the works.
Yeah. That's a great way to put it.
And this buildup can actually lead to protein loss and kidney failure.
Potentially, yeah.
Potentially. Yeah, that's scary.
Yeah.
Are certain breeds more likely to get this than others?
Shar-Peis and Beagles, they seem to have a higher risk of developing amyloidosis.
Okay.
Diagnosing it can be tricky, though.
Oh, really?
Yeah, vets often have to perform a kidney biopsy and use a special stain that identifies those amyloid deposits.
Okay, so it's a little more intense to diagnose this one.
Yeah.
Okay, what about glomerulonephritis?
All right, so this one's an immune-mediated disease.
Okay.
Imagine your dog's immune system, which is supposed to be protecting them, it mistakenly starts attacking the kidneys.
Oh, no.
Yeah.
So it's like friendly fire,
Yeah, exactly.
but inside the body.
Yes, and specifically, it attacks the glomeruli,
Glomeruli.
which are these tiny filters within the kidneys
Okay.
that clean the blood.
Okay, so it's like if a filter in your house was clogged and then letting dirt through.
Exactly.
Okay, gotcha.
So this attack causes inflammation and damage, leading to protein leaking into the urine.
Oh, that's no good.
Yeah. And as the disease progresses, fluid can build up in the body, blood pressure can spike,
Oh.
and in severe cases, dogs can even experience sudden blindness
Oh my gosh.
or neurological problems.
Wow, this sounds really intense.
It can be very serious, yeah.
How do they even diagnose this?
So there's a test called the urine protein to creatinine ratio,
Okay.
or UPC.
UPC?
Okay, that can help determine the extent of protein loss.
Okay.
And sometimes a kidney biopsy might be necessary to confirm the diagnosis.
Okay, so again, early intervention
Yeah,
is
definitely.
always best.
Mm-hmm.
All right, let's talk about leptospirosis.
Okay, leptospirosis. So this one's a bacterial infection that can be transmitted between animals and humans.
Between animals and humans.
So we call it zoonotic.
Zoonotic, okay.
It's definitely a concern for both our furry friends and us humans.
Wow, so this could be like if you go to the lake or the dog park,
Yeah,
your dog could get it,
Mhm.
and then you could get it.
potentially. Yeah.
Okay, that's scary.
Yeah, it's good to be aware of the risks.
So how would a dog get this typically?
Typically through contact with contaminated water or soil,
Okay.
or even urine from infected wildlife.
Oh, wow, okay.
So it can be lurking in a lot of places.
So what would you be looking out for in terms of symptoms?
Symptoms can really range from mild to severe.
Okay.
So you might see fever, lethargy, vomiting, loss of appetite. Okay.
And sometimes even jaundice,
Jaundice, okay.
which makes the skin and eyes look yellowish.
Okay.
In severe cases, it can cause acute kidney injury.
Wow. Okay, so early diagnosis is, I assume, really important.
Absolutely, yeah.
Like, how do they even figure out if a dog has this?
So vets use different methods like paired serology,
Okay.
which looks for a rise in antibodies,
Okay.
or PCR testing,
Okay.
which directly detects the bacteria's DNA.
Okay, so various testing methods.
Yeah, it just depends on, the situation and what the vet thinks is best.
Okay, interesting.
Yeah.
All right, let's talk about cystitis.
Okay.
Now, cystitis, this is something that, I feel like a lot of dog owners, they might have heard of this before.
Yeah, it's a pretty common one.
So tell me, what is it?
So cystitis just means inflammation of the urinary bladder.
Okay.
It's often caused by a bacterial infection.
Okay.
And unfortunately, female dogs are more prone to it
Why is that?
because their urethra is shorter.
Oh, making it easier for bacteria to travel up into the bladder.
That doesn't seem very fair.
No, not really.
But it's just the way it is.
It's anatomy.
Yeah. So what are the signs of cystitis?
The most common one is painful urination, which vets call dysuria.
Dysuria. Okay.
So you might notice your dog straining to pee, only producing small amounts of urine,
Okay.
or even crying out in pain.
Oh, poor pups.
Yeah, it's not fun.
So how do they figure out like what's causing this?
They'll usually do a urine culture,
Okay.
which helps identify the specific bacteria causing the problem.
Okay.
And that guides the choice of antibiotics.
Right, because different antibiotics target different.
Exactly.
Okay.
So we want to make sure we're using the right one.
Okay, let's talk about urinary stones.
All right. Urinary stones, also known as uroliths.
Uroliths. Okay.
These are little troublemakers that form when minerals in the urine crystallize.
Okay.
And there are actually different types of stones,
Oh,
each with their own causes and treatment approaches.
So it's not just like one urinary stone.
No, it's not that simple, unfortunately.
All right. So what are the different types?
So we've got struvite stones,
Okay.
which often form in alkaline urine and are linked to UTIs.
Okay.
Then we have calcium oxalate stones,
Okay.
which are more common in acidic to neutral urine.
Okay.
And those are often related to diet or issues with calcium regulation.
Gotcha. Okay. So two very different
Yeah, very different types.
types of stones with very different causes.
Yeah.
Are there any other types that we should know about?
We also have ammonium urate stones,
Okay.
which are more common in dogs with liver problems,
Okay.
and then cysteine stones.
Okay.
Those result from a genetic disorder that affects cysteine reabsorption.
So many different types.
There's a lot going on.
And I assume the treatment then is very specific to the type of stone.
It is,
Yeah.
yeah. Dietary changes are often the first line of defense,
Okay.
especially for stuvite stones,
Okay.
but sometimes surgical removal or even lithotripsy.
Lithotripsy. Now, what is that?
So that's a procedure that uses sound waves to break up the stones.
Oh, wow.
Yeah, it's pretty cool.
Okay, so there are non-surgical and surgical options.
Right. Depends on the situation.
Okay, let's talk about a big one. Chronic kidney disease.
All right, CKD. So this one's a progressive and irreversible disease that's sadly quite common as dogs get older.
Okay.
It happens when the kidneys gradually lose their ability to function properly.
So it's like their little filters are just kind of wearing out.
Yeah, they just can't keep up anymore.
Yeah.
And as kidney function declines, waste products start building up in the bloodstream.
Oh, that doesn't sound good.
No, it leads to a whole host of problems.
Okay, so what should people be on the lookout for in terms of the early signs of CKD?
Increased thirst and urination, those are often the first clues.
Yep.
You might also notice changes in appetite, weight loss, lethargy, and even bad breath.
Bad breath. That's interesting.
Yeah, it's actually a common symptom of CKD,
Right.
often described as a uremic breath. It happens because the kidneys aren't filtering out waste products effectively,
Oh.
and some of those wastes end up being released through the breath.
Okay, so that's something that, I would have never thought of.
Yeah, it's not the first thing that comes to mind.
Right, so how do vets diagnose CKD?
So there's a test called symmetric dimethylarginine,
Okay.
or SDMA for short,
SDMA.
that can detect kidney dysfunction even in the early stages.
Okay.
And of course, we also look for persistent azotemia,
Oh, yeah.
which just means elevated levels of waste products in the blood.
Okay, so early detection is really important with CKD.
Absolutely.
The earlier we catch it, the better chance we have of slowing its progression.
Yeah, is there a cure for CKD?
Sadly, no.
Okay.
But there are ways to manage the disease.
Okay, tell me more about that. What does managing CKD involve?
It typically involves a multifaceted approach,
Okay.
including a special renal diet,
Okay.
medications to control blood pressure and manage other symptoms,
Okay.
and in some cases, even fluid therapy. Okay, so it's really about providing that supportive care.
Right. It's all about improving the dog's quality of life.
Okay, so this is a tough one,
It is, yeah.
but there are things that can be done to help manage it.
Definitely.
Now, let's talk about something that can be embarrassing: urinary incontinence.
Okay. Urinary incontinence, or involuntary leakage of urine, it's surprisingly common,
Oh, really?
especially in middle-aged to older spayed females, particularly larger breeds.
Okay, now is that just like part of getting older, or?
Age can play a role, but often it comes down to something called urethral sphincter mechanism incompetence,
Okay, break that down for me.
or USMI for short.
USMI, okay.
It's a mouthful, but basically it means the muscles that control urinary flow, they weaken.
Okay, so they're just not as strong as they used to be.
Yeah, they have trouble holding it in, especially when relaxed or sleeping.
Oh, poor pups.
Yeah.
But are there treatments available for this?
There are.
Okay.
Medications like estrogen supplements or alpha-adrenergic agonists can help strengthen those urethral sphincter muscles and reduce leakage.
Okay, so there is hope for our leaky pups.
There is, yep.
Now let's talk about bladder tumors.
Okay, so bladder tumors, specifically a type called transitional cell carcinoma, or TCC,
DCC. Okay.
those are unfortunately the most common type of bladder cancer in dogs.
Okay. Are there any breeds that are more likely to get this?
Scottish Terriers and Shetland sheepdogs, they seem to have a higher risk.
Okay, so if you have one of those breeds, it's definitely something to be aware of.
Yeah, keep an eye out.
Okay.
Yeah.
So what are the warning signs that pet owners should be aware of?
Blood in the urine is a big red flag.
Okay.
It's not always visible to the naked eye, though.
Okay.
So sometimes it's only picked up during a urinalysis at the vet.
Okay, gotcha.
You might also notice your dog straining to urinate, going more frequently, or having accidents in the house.
Now those symptoms could also be signs of other things that we've talked about, right?
Exactly. That's why it's so important to see a vet if you notice any changes in your dog's urination habits.
Okay.
Early detection is key for any bladder issue.
Okay, so if it turns out to be TCC, what are the treatment options?
So non-steroidal anti-inflammatory drugs,
Mhm.
or NSAIDs like piroxicam,
Oh.
those are often used for their anti-cancer and pain-relieving effects.
Okay.
Chemotherapy is sometimes recommended for more advanced cases,
Okay.
and there are also newer targeted therapies being developed.
Oh, wow. That's really encouraging.
Yeah, it's an exciting time for veterinary oncology.
Yeah, it seems like there's always new things coming out, new ways to help.
Definitely.
You mentioned earlier a new non-invasive diagnostic tool for TCC, the BRAF mutation test.
Oh, yeah, that's a cool one.
Tell me about that.
It's a simple urine test that can detect a specific mutation in the BRAF gene,
Okay.
which is often present in canine bladder tumors.
Okay.
It's not perfect, but it's a promising new tool that can help vets make a diagnosis.
Wow, and this is just a urine test?
Yeah.
That's amazing.
Yeah, no biopsies or anything like that.
Wow, that's really cool.
Yeah, it's a good option for some dogs.
Okay, so science is coming through for our furry friends.
Oh, wait.
What about pyelonephritis?
Pyelonephritis, so this is basically a bacterial infection of the kidneys.
Okay.
It can happen when a lower urinary tract infection, like cystitis, travels up to the kidneys.
So it's like cystitis, but worse.
Yeah, you could say that.
Okay.
It can get pretty serious if not treated promptly.
Oh, okay.
Yeah.
So what are the signs that a dog might have pyelonephritis, aside from the usual, like, UTI symptoms?
So with pyelonephritis, you might also see signs of systemic illness like fever, lethargy, loss of appetite.
Uh-huh.
Think of it as the infection going beyond the bladder and affecting the whole body.
Okay, so it's not just discomfort, it's actual illness.
Right, yeah.
Gotcha.
It can get into the
Oh,
bloodstream.
wow. Okay.
Yeah.
So how do vets diagnose and treat pyelonephritis?
Typically, we'll perform a urine culture to pinpoint the bacteria and choose the most effective antibiotics. And since pyelonephritis is a deeper infection, a longer course of antibiotics is usually needed,
Okay.
often for several weeks.
Okay, so it's more intense treatment.
Yeah, we need to make sure we fully knock out that infection.
Right, and make sure it doesn't come back.
Right,
Okay. I imagine early detection and treatment here are crucial.
absolutely.
Yeah.
The sooner we can get rid of that infection, the better.
Okay, so that's pyelonephritis, everyone.
Another one to be aware of.
Now, let's talk about a condition that requires immediate veterinary attention, urethral obstruction.
Yeah, this one's a true medical emergency.
Okay, tell me about it. What is a urethral obstruction,
So it happens when the flow of urine is completely blocked.
and what causes these blockages?
Urinary stones are a common culprit,
Okay.
but we also see blockages caused by urethral plugs, tumors, or even scar tissue.
Okay, so it's like, a pipe getting clogged,
Exactly, yeah.
but it's inside the body.
Yeah, and just like a blocked pipe, the pressure can build up quickly.
Oh, that's scary.
Yeah, it can cause serious damage.
So what should pet owners be looking out for?
If you notice your dog straining to urinate, producing little to no urine, showing signs of abdominal pain, or even becoming lethargic,
Okay.
seek veterinary care immediately.
This is one of those don't wait and see.
No, time is of the essence with this condition.
Okay, got it.
Yeah.
So how is it treated?
The first step is to relieve the obstruction,
Okay.
which usually involves catheterization under sedation or anesthesia.
Okay.
And then, depending on the cause, further treatment might be necessary.
Okay, so you have to get that blockage out
Yeah, that's the priority.
and then figure out what caused it.
Right, address the underlying issue.
Okay, let's wrap up this first part of our deep dive with urolithiasis,
Okay.
which we touched upon earlier when talking about urinary stones.
Yeah, urolithiasis is just the medical term for the formation of those stones.
Oh, okay.
So we've already covered the different types
We have.
and how treatment varies depending on the type of stone. So for example, struvite stones can often be managed with a special diet and antibiotics,
Okay.
while calcium oxalate stones might require surgical removal or lithotripsy.
Okay, so it's not just about getting rid of the stone.
No, it's about prevention too.
Right.
Figuring out why they're forming in the first place.
Right, so that they don't come back.
Exactly.
Okay, so that wraps up the first part of our deep dive.
Lots of information.
I don't know about you, but I feel like my brain is already full.
My head is spinning a little bit, but in a good way.
Yeah, in a good way.
Yeah,
We've learned a lot
I have.
about all these different urinary conditions. And hopefully, you at home are also learning a lot.
Yeah, I hope so.
But before we move on to the next part, I'd love to hear what stood out to you the most, dear listener.
Yeah, what surprised you?
What are you thinking about?
What are you worried about?
We'll be back soon with more fascinating insights.
Yeah, we've got more to cover.
So stay tuned.
Don't go anywhere.
Welcome back to our deep dive on canine urinary diseases. We've already covered so much ground, but there's still so much to explore. I'm particularly curious to learn more about urinary incontinence, especially since you mentioned it's common in older spayed females.
It's definitely something we see a lot in practice. As dogs age, those muscles responsible for bladder control can weaken, just like in humans. And spaying can sometimes play a role as well, because the decline in estrogen levels after the procedure can affect those muscles too.
So it's like a canine version of menopause in a way.
You could say that. The good news is there are effective treatments available. Medications like estrogen supplements or alpha-adrenergic agonists can help strengthen those muscles and reduce leakage.
That's reassuring to know. Now let's switch gears to bladder tumors, a topic that I'm sure is on many dog owners' minds. You mentioned transitional cell carcinoma, or TCC, as the most common type. What are the warning signs that pet owners should be aware of?
Blood in the urine is a big one. It's not always visible to the naked eye, though, so sometimes it's only picked up during a urinalysis at the vet. Other signs can include straining to urinate, urinating more frequently, or having accidents in the house.
Those symptoms can also be indicative of other urinary problems we've talked about, right?
Exactly. It's like a detective game sometimes, figuring out what's causing those symptoms. That's why it's so important to see a vet if you notice any changes in your dog's urination habits. Early detection is crucial for any bladder issue.
And if it turns out to be TCC, what are the treatment options?
Non-steroidal anti-inflammatory drugs, or NSAIDs like piroxicam, are often used for their anti-cancer and pain-relieving effects.
Hmm.
Chemotherapy is sometimes recommended for more advanced cases, and there are also newer targeted therapies being developed, which is really exciting.
That is encouraging. It seems like veterinary oncology is constantly advancing. Speaking of advancements, you mentioned earlier a new non-invasive diagnostic tool for TCC, the BRAF mutation test.
Yes. It's a simple urine test that can detect a specific mutation in the BRAF gene, which is often present in canine bladder tumors. It's not perfect, but it's a promising new tool that can help vets make a diagnosis without the need for invasive procedures like biopsies.
That's amazing. It seems like science is constantly finding new ways to help our furry friends. Now, let's talk about pyelonephritis. It sounds a bit intimidating. Can you break it down for us?
Pyelonephritis is essentially a bacterial infection of the kidneys. It can happen when a lower urinary tract infection, like cystitis, travels up to the kidneys.
So it's like a UTI that's escalated.
Exactly, and it can get pretty serious if not treated promptly.
What are the signs that a dog might have pyelonephritis, aside from the usual UTI symptoms?
With pyelonephritis, you might also see signs of systemic illness, like fever, lethargy, and loss of appetite. Think of it as the infection going beyond the bladder and affecting the whole body.
That makes sense. How do vets diagnose and treat pyelonephritis?
We'll typically perform a urine culture to pinpoint the culprit bacteria and choose the most effective antibiotics. And since pyelonephritis is a deeper infection, a longer course of antibiotics is usually needed, often for several weeks.
I imagine early detection and treatment are crucial here to prevent any long-term kidney damage.
Absolutely. The sooner we can knock out that infection, the better. And just like with other urinary conditions, addressing any underlying factors that might have contributed to the infection, like bladder stones or anatomical abnormalities, is also important.
Okay, so it's not just about treating the infection itself, but also addressing any predisposing factors. Now, let's talk about a condition that sounds like a true medical emergency urethral obstruction.
This one is definitely a race against time. It occurs when the flow of urine is completely blocked, and the consequences can be dire if not addressed quickly.
What typically causes these blockages?
Urinary stones are a common culprit, but we also see blockages caused by urethral plugs, tumors, or even scar tissue. It can happen to any dog, but male dogs are more prone to it because their urethra is longer and narrower.
That makes sense. So it's like a tiny pipe getting clogged, but with potentially life-threatening consequences.
Right.
What should pet owners be watching for?
Any signs of straining to urinate, producing little or no urine, showing discomfort or pain, or even acting lethargic warrant immediate veterinary attention. Don't wait and see. With this one, every minute counts.
And how is urethral obstruction treated?
The first priority is to relieve the obstruction, which usually involves catheterization under sedation or anesthesia. Once the blockage is cleared, we can focus on addressing the underlying cause, which might involve medications, dietary changes, or even surgery.
So it's a two-pronged approach. Address the immediate blockage and then tackle the root cause. Now, let's revisit urolithiasis, the formation of urinary stones, which we touched upon earlier. You mentioned that different types of stones require different management approaches.
Exactly. For instance, those struvite stones we discussed earlier, which often form in response to bacterial infections, can often be dissolved with a special diet and antibiotics. Calcium oxalate stones, on the other hand, are less likely to dissolve and might require surgical removal or lithotripsy.
So it's not just about blasting those stones away, but also understanding their composition and choosing the most effective strategy.
Right. And just as importantly, we need to figure out what's causing those stones to form in the first place. This might involve analyzing the dog's diet, checking for underlying medical conditions, and recommending lifestyle changes to reduce the risk of recurrence.
It sounds like a real detective game, piecing together all the clues to solve the mystery of those pesky stones. Now, let's talk about a condition that often affects our older canine companions, chronic kidney disease, or CKD.
This is a tough one, as it's a progressive and irreversible condition. It's heartbreaking to see, but it's sadly quite common as dogs enter their golden years.
It must be difficult for both dogs and their owners to cope with CKD. What are the early signs that pet owners should be aware of?
Increased thirst and urination are often the first clues. You might also notice changes in appetite, weight loss, lethargy, and even that characteristic uremic breath we talked about earlier.
It seems like those early signs could easily be dismissed as just normal aging changes.
That's true, and that's why regular veterinary checkups are so crucial for senior dogs. Blood and urine tests can help detect kidney problems early on when treatment is most effective.
Is there a cure for CKD?
Unfortunately, no. But with proper management, we can significantly slow its progression and help dogs live longer, happier lives.
Tell us more about that. What does managing CKD involve?
It often involves a multi-pronged approach. Dietary modifications are key, as is managing any underlying medical conditions that might be contributing to kidney damage. Medications can help control blood pressure and other complications, and in some cases, fluid therapy might be necessary.
It sounds like a real team effort involving the vet, the owner, and the dog themselves.
Exactly. It takes a village to support a dog with CKD. Open communication between the vet and owner is essential to ensure the dog's needs are met and their quality of life is maintained.
Now let's talk about a condition that can be quite embarrassing, both for dogs and their owners, urinary incontinence.
We see this a lot, especially in middle-aged to older spayed females. Those muscles responsible for holding urine can weaken over time, leading to leaks, especially when the dog is relaxed or sleeping.
It's like they lose bladder control, kind of like humans who experience incontinence.
Yes, exactly. It can be quite distressing for both dogs and owners, but the good news is there are effective treatments available.
What kind of treatments are we talking about?
Medications like estrogen supplements or alpha-adrenergic agonists can help tighten those leaky muscles and reduce accidents. There are also surgical options in some cases, depending on the cause and severity of the incontinence.
That's good to know. So there's hope for our leaky pups and their sleep-deprived owners.
Absolutely. We want to help those dogs live comfortably and confidently without the worry of accidents.
Now, let's shift our attention to a topic that often brings a groan from dog owners' anal gland problems.
Ah, yes, those little sacs can be a real pain, both literally and figuratively.
For those who might not be familiar, could you explain what anal glands are and why they sometimes cause problems?
Anal glands are small sacs located on either side of the anus, and they produce a foul-smelling fluid that dogs use for scent marking. Think of it as their personal signature scent.
And sometimes those glands get clogged or infected, right?
Exactly. When that happens, you might see your dog scooting their bottom across the floor, licking or biting at the area, or having trouble pooping. In severe cases, the glands can even abscess, which is quite painful.
That sounds awful. What can be done to help these poor pups?
If the glands are simply impacted, a vet can manually express them. It's not the most glamorous procedure, but it provides quick relief for the dog. If the glands are infected, antibiotics are usually necessary, and sometimes we need to flush the glands with an antiseptic solution.
Are there ways to prevent these anal gland issues in the first place?
Adding fiber to the dog's diet can help bulk up their stools, which can make it easier for the glands to empty naturally. And some dogs might benefit from regular manual expression by a vet, especially if they're prone to recurring problems.
Okay, so a little preventative care can go a long way in keeping those anal glands happy. Now, let's dive into a topic that's often shrouded in mystery: canine cognitive dysfunction.
Canine cognitive dysfunction, also known as dog dementia, is a neurodegenerative disease that affects senior dogs, much like Alzheimer's disease in humans.
It's sad to think of our furry friends experiencing cognitive decline. What are the signs that a dog might be developing canine cognitive dysfunction?
You might notice changes in their sleep-wake cycle, disorientation or confusion, altered interactions with family members, changes in activity levels, and house soiling. They might seem lost in their own home or forget learned behaviors.
Those signs can be subtle, though, and easily mistaken for just normal aging.
That's true. That's why it's important to bring any concerns to your vet's attention. They can assess the dog's cognitive function and rule out other possible causes for the changes you're seeing.
Is there a cure for canine cognitive dysfunction?
Sadly, no. But there are things we can do to manage the disease and improve the dog's quality of life.
Tell us more about that. What does managing canine cognitive dysfunction involve?
There are medications that can help improve cognitive function, as well as dietary supplements and environmental modifications that can make the dog's environment more stimulating and engaging. Think puzzle toys, new routines, and plenty of mental stimulation.
So it's about creating a supportive and enriching environment for these senior pups.
Exactly. And just like with any senior pet, regular vet checkups are essential to monitor their overall health and well-being and make any necessary adjustments to their care plan.
Now let's talk about a topic that's especially relevant for dog owners who live in rural areas or spend a lot of time outdoors with their pets' tick-borne diseases.
Tick-borne diseases are a growing concern, and they can cause a wide range of health problems in dogs. We're talking about things like Lyme disease, ehrlichiosis, anaplasmosis, and Rocky Mountain spotted fever, to name a few.
Those are some serious illnesses. And ticks seem to be everywhere these days. What can dog owners do to protect their pets?
Prevention is key. There are a variety of tick preventatives available, including topical medications, oral medications, and collars. Talk to your vet about which option is best for your dog's lifestyle and risk factors.
And it's important to use these preventatives year-round, right? Even in the winter.
Ideally, yes, ticks are most active in the warmer months, but they can be present at any time of year, especially in milder climates. Don't let those sneaky little critters catch you off guard.
And what about checking for ticks after being outdoors? Is that still important even if you're using a preventative?
Absolutely. No preventative is 100% effective, so it's always a good idea to run your hands over your dog's entire body after being in tick-prone areas, paying close attention to hidden spots like the ears, armpits, and groin.
Okay, so vigilance is key. And what's the best way to remove a tick if you find one?
Use fine-tip tweezers to grasp the tick as close to the skin as possible and pull upward with steady, even pressure. Avoid twisting or jerking the tick, as this can cause the mouth parts to break off and remain embedded in the skin.
Once the tick is removed, what should you do with it?
You can dispose of it by flushing it down the toilet or placing it in a sealed container filled with rubbing alcohol. And it's a good idea to keep an eye on the bite site for any signs of infection, like redness, swelling, or discharge. If you notice anything unusual, contact your vet.
It's amazing how such tiny creatures can cause such big problems. Now let's talk about a condition that's near and dear to my heart. Heartworm disease.
Heartworm disease is a serious and potentially fatal condition that affects dogs, caused by parasitic worms that live in the heart and lungs. These worms are spread through the bite of an infected mosquito.
So any dog that spends time outdoors is at risk.
That's right. Even dogs that live indoors primarily are still at risk, as mosquitoes can easily find their way inside.
What are the symptoms of heartworm disease?
In the early stages, there might be no symptoms at all. But as the infection progresses, you might notice coughing, difficulty breathing, exercise intolerance, and weight loss.
Those symptoms can also be indicative of other conditions, though.
That's true. That's why it's so important to have your dog tested for heartworms annually, even if they're on preventative medication.
And speaking of prevention, what's the best way to protect dogs from heartworms?
There are a variety of heartworm preventatives available, including monthly chewable tablets, topical medications, and injections. Talk to your vet about the best option for your dog.
And it's important to give these preventatives year-round, right? Even in areas with colder climates.
Absolutely. Even in colder climates, mosquitoes can still be active during certain times of year.
And what happens if a dog does get infected with heartworms?
Treatment is available, but it's lengthy, expensive, and can have side effects.
So prevention is definitely the best approach.
Without a doubt. Protecting your dog from heartworms is much easier and less stressful than treating an infection.
Now let's talk about a condition that's often associated with brachycephalic breeds. Brachycephalic obstructive airway syndrome, or BOAS for short.
BOAS is a collection of anatomical abnormalities that affect the upper airways of dogs with short, flat faces, like bulldogs, French bulldogs, and pugs. Their shortened skull structure can lead to narrowed nostrils, an elongated soft palate, and other airway obstructions.
It's like their adorable smooshed faces come with a built-in breathing challenge. What are the symptoms of DOAS?
You'll likely notice noisy breathing, especially during exercise or excitement. They might snort, snuffle, or gag. And in severe cases, BOAS can lead to difficulty breathing and even collapse.
That sounds scary. What can be done to help dogs with BOA?
In mild cases, lifestyle modifications, such as avoiding strenuous exercise and keeping the dog cool, might be sufficient. But in more severe cases, surgery might be necessary to widen the nostrils, shorten the soft palate, and remove other airway obstructions.
It's amazing what surgical intervention can do to improve a dog's breathing.
It really is. And it can make a world of difference for dogs with BOS, allowing them to breathe more easily and live more comfortably.
Now let's talk about a condition that often sounds a lot worse than it actually is: reverse sneezing.
Reverse sneezing is a sudden, forceful inhalation of air through the nose, often triggered by irritants like dust, pollen, or perfumes.
It can sound pretty alarming. I've heard it described as a honking or snorting sound.
That's a pretty accurate description. It usually only lasts for a few seconds, and it's more of an annoyance than a serious medical problem.
But if it happens frequently or for prolonged periods, It's a good idea to check with your vet, right?
Exactly. While reverse sneezing is usually harmless, it's always best to rule out any underlying medical conditions, especially if the episodes are frequent or intense.
Okay, so it's all about knowing when a quirky behavior might signal something more serious. Now, let's talk about a condition that can be quite frustrating and distressing for both dogs and owners: separation anxiety.
Separation anxiety is a behavioral disorder that occurs when dogs become excessively anxious when left alone.
It's like they can't handle being away from their beloved humans. What are some common signs of separation anxiety?
Dogs with separation anxiety might bark excessively, howl, whine, pace, destroy property, or even try to escape.
It sounds like it can be quite destructive, both for the dog and the home.
It can be. And it's important to address separation anxiety as it can significantly impact the dog's well-being.
What are the treatment options for separation anxiety?
Behavior modification techniques are often the cornerstone of treatment. This might involve gradually acclimating the dog to being alone, providing them with a safe and comfortable space, and rewarding calm behavior.
And in some cases, medication might be recommended as well.
Yes, anti-anxiety medications can help reduce the dog's anxiety levels and make it easier for them to cope with being alone. It's important to work with a veterinarian or a certified animal behaviorist to develop a treatment plan that's tailored to the individual dog's needs.
Okay, so a multifaceted approach is often needed for this complex behavioral issue. Now, let's talk about a condition that's becoming increasingly common in dogs, just like in humans: obesity.
Obesity is a major health concern for dogs, as it increases their risk for a whole host of other problems like joint issues, heart disease, diabetes, and even certain types of cancer.
It's heartbreaking to see overweight pups struggling to get around. What are the main causes of obesity in dogs?
It usually boils down to a combination of overfeeding and lack of exercise. Sometimes underlying medical conditions like hypothyroidism can also contribute to weight gain as they can slow down a dog's metabolism.
So it's important to rule out any underlying medical issues before starting a weight loss program. What can dog owners do to help their overweight pups slim down safely?
The first step is to consult with your vet. They can assess your dog's overall health, rule out any medical conditions, and help you develop a safe and effective weight loss plan.
And this plan will likely involve both dietary changes and increased exercise.
Exactly. Your vet can recommend a balanced diet that's appropriate for your dog's age, breed, and activity level. They can also suggest ways to increase your dog's activity levels, such as taking them for more walks, playing fetch, or enrolling them in an agility class.
It's important to make gradual changes, though, and avoid putting your dog on a crash diet.
Absolutely. Sudden, drastic changes in diet or exercise can be harmful to your dog's health. We want to help them lose weight safely and sustainably so they can enjoy a long, healthy life.
Now, let's talk about a topic that can be quite frustrating and distressing for both dogs and owners:
Allergies. Allergies are a common problem in dogs, and they can manifest in a variety of ways, from itchy skin to respiratory problems.
What are the most common allergens that affect dogs?
Fleas, food, and environmental allergens like pollen, dust mites, and mold are the usual suspects.
So it's like a detective game, figuring out what's triggering those allergic reactions. How do allergies typically show up in dogs?
Itchy skin is often the most noticeable symptom. You might see redness, inflammation, hair loss, and even secondary skin infections from all that scratching. Some dogs also experience respiratory symptoms like sneezing, coughing, and difficulty breathing.
And in severe cases, allergies can lead to anaphylaxis, right? Which is a life-threatening allergic reaction.
Exactly. That's why it's so important to take allergies seriously and seek veterinary care if you suspect your dog might be allergic to something.
How do vets diagnose allergies in dogs?
We'll start by taking a detailed history and performing a physical exam. Based on the suspected allergens, we might recommend allergy testing, which can involve blood tests or intradermal skin testing.
And once the culprit allergen is identified, what are the treatment options?
Treatment depends on the type of allergy and the severity of the symptoms. Avoiding the allergen is always the best approach, but this isn't always possible, especially with environmental allergens.
What other options are there?
Medications like antihistamines, corticosteroids, and immunosuppressants can help control the allergic reaction, and there are also a variety of immunotherapy options available, which can help desensitize the dog to the allergen over time.
It sounds like managing allergies can be quite a journey, but thankfully, there are various tools available to help these itchy pups find relief. Now let's shift our focus to a more sensitive topic: euthanasia.
Euthanasia is a difficult topic to discuss, but it's an important one. It's the humane ending of a pet's life to relieve suffering when their quality of life has significantly declined.
It's a decision that no pet owner wants to make, but sometimes it's the kindest and most compassionate choice. What factors should be considered when making this difficult decision?
The pet's quality of life is paramount. Are they still able to enjoy the things they used to? Are they in pain? Are they able to eat, drink, and eliminate normally? We also need to consider the owner's ability to provide the necessary care and support for a pet with a declining condition. Sometimes financial constraints can play a role in the decision as well.
It's a complex and heart-wrenching decision, and I'm sure it's helpful for owners to have their vet's guidance and support during this difficult time. What can owners expect during the euthanasia procedure itself?
The procedure is typically very peaceful. We administer an overdose of an anesthetic agent, which causes the pet to fall asleep and then stop breathing. It's a quick and painless process.
It's important for owners to know that they can be present during the procedure if they choose to.
Absolutely. And we always encourage owners to say their goodbyes and spend some quiet time with their pet before and after the procedure. It's also important for owners to have a support system in place during this difficult time. Talk to family and friends, or seek support from a grief counselor or a pet loss support group.
Losing a pet is never easy, but knowing that you made the best decision for them can provide some comfort.
That's true. And it's important to allow yourself time to grieve and to remember the joy that your pet brought into your life.
Well, this second part of our deep dive has certainly covered a lot of emotional ground, from the joy of seeing our dogs thrive to the heartbreak of saying goodbye. We've explored a wide range of canine health issues, and I feel much more equipped to recognize potential problems and advocate for my own furry friends' well-being.
Knowledge is power, and by understanding these conditions and recognizing those early warning signs, we can make a real difference in our dogs' lives.
Before we move on to our final part, I want to ask you, dear listener, what's resonated with you the most in this discussion? Have you had any personal experiences with these conditions, or perhaps learned something new that you'll be sharing with your fellow dog lovers? We'll be back soon to wrap up our deep dive, so stay tuned for more insights. All right, welcome back to the final part of our deep dive all about canine urinary diseases.
It's been quite a journey.
It really has. My brain is very full.
Lots to take in.
Yes.
But that's good. That's what we're here for.
Yeah, absolutely. Knowledge is power.
Right.
So we talked a lot about chronic kidney disease, or CKD, in the previous segments. And, you know, it's a serious condition. There's no cure.
Right. It's irreversible.
Right. But you did say that early detection is so important for managing this effectively.
Absolutely.
So can you remind us, like, what are those early warning signs that people should be on the lookout for?
So increased thirst and urination, those are often the first things that owners will notice.
Okay.
You might also see changes in appetite, weight loss, lethargy, maybe even bad breath.
Right, that uremic breath.
Yes, exactly.
But those signs can be subtle, especially in the early stages.
Definitely.
So that's why, you know, those regular vet checkups
So important.
for senior dogs
Especially for senior dogs, yeah.
are so important. It's not just about the vaccines.
Right.
It's about, you know, catching these things.
Catching those early signs.
Early.
Yeah.
And so blood and urine tests, I assume, are really helpful for this.
Oh, absolutely. Those are powerful tools for detecting kidney problems. And when we can catch them early on, that's when treatment is most effective.
Right. And while there's no cure, there are ways to manage it.
Definitely.
So tell me a little bit about, you know, what does managing CKD actually involve?
Well, it often involves a multifaceted approach.
Okay.
Dietary modifications are key.
Yeah.
Managing any underlying medical conditions that might be contributing to the kidney damage.
Okay.
Medications can help to control blood pressure and other complications.
Okay.
And in some cases, fluid therapy might be necessary.
Okay. So it can be a lot.
It can be.
But it sounds like, you know, again, working with your vet
Very important.
and, you know, early detection
Mm-hmm.
is really, really key.
Absolutely.
Let's shift gears a little bit. Let's talk about urinary incontinence.
Okay.
Which, you know, you said is a fairly common issue, especially in older spayed females.
Yeah, we see it quite a bit. And thankfully, it's usually very manageable.
Okay.
As dogs age, those muscles responsible for controlling urination, they can weaken, just like in humans.
Yeah, things start to sag a little bit.
Exactly. Gravity takes over.
And spaying can also contribute to this.
Right, because the decline in estrogen after the procedure can affect those muscles.
Okay, so it's not just, you know, like, oh, they're just getting old.
Right, it's multifactorial.
It's more than that.
Yeah,
But the good news is there are treatments available.
absolutely.
So tell me about those.
So medications like estrogen supplements or alpha-adrenergic agonists.
Okay.
Those can help to strengthen those muscles and reduce leakage.
Okay, so there is hope
There is, yeah,
for those pups who might be having some accidents.
definitely.
Let's talk about bladder stones.
Okay, bladder stones.
So you mentioned they can be pretty problematic, but also that there's different types of stones that require different approaches.
Exactly, yeah.
So can you just break that down for me a little bit? What are we talking about here?
So bladder stones, or uroliths as we call them, are these hard mineral deposits that form in the bladder, and they can cause a range of problems, from discomfort and inflammation to blockages and even infections.
Wow, so it's not just like one type of stone that's causing all the trouble.
Nope, there's a variety.
Okay.
The most common types are struvite stones, which often form in alkaline urine, and calcium oxalate stones, which are more prevalent in acidic urine.
Okay.
And just like in humans, diet can play a significant role
Oh, interesting.
in the formation of these stones.
Okay, so what's the best approach then for dealing with these bladder stones?
Well, it really depends on the type of stone and the individual dog.
Okay.
Some stones, like struvite stones, can often be dissolved with a special diet and antibiotics.
Okay.
Others, like calcium oxalate stones, are less likely to dissolve and might require surgical removal or lithotripsy.
Okay, so,
Yeah.
Again, working with your vet
Absolutely.
to figure out what's going on and what the best approach is.
Yeah, individualized treatment.
Okay, let's talk about urinary tract infections, or UTIs,
Okay.
which, are common in both humans and dogs.
Very common.
So what are they and what are the signs?
So UTIs are bacterial infections of the urinary tract.
Okay.
That includes the bladder, the urethra, and the kidneys.
Okay.
They're more common in female dogs because their urethra is shorter.
Right, so it's just easier for bacteria to get up there.
Exactly. It can travel up to the bladder easier.
So what are the signs?
The most common symptoms are frequent urination, straining to urinate, blood in the urine.
Okay.
You might also notice your dog licking their genitals more frequently than usual.
Okay, so any changes in urination habits
Definitely a red flag.
should warrant a trip to the vet.
Absolutely. It's always better to err on the side of caution
Right.
and have your dog checked out.
Okay.
UTIs are usually easily treated with antibiotics.
Okay, that's good.
But if left untreated, they can spread to the kidneys
Wow.
and cause more serious problems.
Okay, so again, early detection
Yes.
is so important.
Always.
So we've talked a lot about all these different conditions. But I want to kind of shift gears a little bit and talk about just diet in general
Okay.
and its role in canine urinary health,
Yeah, that's a great point.
because it seems like it's come up a couple of times.
Absolutely. Diet plays a huge role
Right.
in maintaining a healthy urinary tract.
So what are some general tips that people can follow?
So first and foremost, make sure your dog has access to fresh, clean water at all times.
Okay, hydration.
Hydration is crucial.
Water.
Yes. Gotta flush out those toxins.
In terms of food?
In terms of food, choose a high-quality, balanced diet that's appropriate for your dog's age, breed, and activity level.
Okay.
And if your dog has a history of urinary problems, your vet might recommend a special prescription diet
Okay.
that's formulated to meet their specific needs.
Right, so it's not just about what they eat, it's also about how much they eat.
Exactly. Portion control is key.
Right, because overfeeding
It'll lead to obesity.
can lead to a lot of problems.
It'll be problems, yeah.
So, it's really finding that balance.
Right. The right kind of food in the right amount,
Yes.
along with plenty of fresh water.
And don't be afraid to ask your vet for their recommendations.
Absolutely, they're your best resource.
Well, that brings us to the end of our deep dive
It does.
into canine urinary diseases.
It's been a lot.
It's been a lot, but I think we've covered a lot of really important information.
I think so too.
I know I've learned a lot.
Me too.
And hopefully you at home have also learned a lot.
Hopefully everyone feels empowered to take better care of their dogs.
Yes, and before we sign off, I just want to ask you, dear listener, what's your biggest takeaway?
Yeah, what are you going to do differently?
What have you learned today that you're going to, put into practice
What are you going to tell your friends?
to help your furry friend maintain a healthy bladder and kidneys?
Yeah, because knowledge is power.
Knowledge is power.
And the more we know, the better we can care for our dogs.
Absolutely. So thank you for joining us on this deep dive.
It's been a pleasure.
We'll catch you on the next one.
Bye, everyone.